Okay, great. So thank you so much for joining us. We sent out a press release about an hour ago about RSV and other respiratory illness rates, and I know that this is something that a lot of you have been asking about for a long time, so we're very excited to have Dr. Kemble and Caroline with us today to discuss. Dr. Kemble?
Thank you, Katie. Thanks for joining us this morning. Respiratory virus season is upon us, and we wanted to take this opportunity to share with you some of the latest numbers from the Hawaii Department of Health on respiratory viruses. We're seeing a lot of sick kids with respiratory illness right now. I want to introduce our Disease Investigation Branch Chief, Caroline Pratt.
Hi, everybody. So just a little background, RSV is a respiratory virus. It causes cold-like symptoms like runny nose, sneezing, cough, fever. In younger kids, you might see irritability or decreased appetite. It primarily affects children under the age of 5. That's been true in past seasons, and it's true this season as well. It can also affect older adults, just like many other respiratory viruses. But I do want to emphasize that most people who become infected with RSV recover completely at home with just supportive care. There's a small number of cases, mostly the very young and older adults with other medical conditions who may require hospitalization, and that's mostly just to support their breathing. Just like any other respiratory illness, if you do have concerning symptoms like difficulty breathing or prolonged fever for several days, you should see your medical provider. To get into some of the numbers, one of the ways we track cases of RSV, cases in testing, is the National Respiratory and Enteric Virus Surveillance System, or NREVS. And if we look at the data for the state of Hawaii, we do see increases in both the number of tests being done and the percentage of tests that are coming back positive. So right now, about 1 in 4 tests being done for RSV is coming back positive. And we are seeing a higher number of positives earlier than we usually do in the season. And so there is, this does suggest both a higher level of detected cases, and there's probably undetected RSV infections in the community. The number of positives is higher than last year. The last 2 years, we had very, very low numbers for all respiratory illnesses because of prevention measures in place for COVID. So I do want to say that even though our numbers are high, they're consistent with the western region of the mainland. So case numbers rose earlier on the East Coast, and they're already beginning to come down there. So hopefully that's going to happen in the West Coast and in Hawaiʻi as well. I do also want to say RSV testing is not always necessary, especially someone who's not in a high-risk group. It should really be more emphasized in very young children and nursing home residents. We do also have flu and COVID circulating. Flu levels are actually relatively low, but it is out there, just like other respiratory viruses this time of year. Out of 3,886 specimens tested for influenza statewide in the week of October 16th to the 22nd, 5.8% of those were positive. And during a similar time frame, statewide SARS-CoV-2 test positivity was 6.4%. So with these respiratory viruses out there, what can we do? One of the biggest things is get vaccinated. There's not a vaccine for RSV, but there is for flu and COVID. Those are widely available, and you can get both vaccines at the same time in one go. Washing your hands is really, really important for RSV especially. It can be spread by touching surfaces that somebody else who's been sick has touched, and so washing your hands frequently is really important. And masking still works. Just like it does for COVID, it works for other respiratory viruses as well. So that still is an effective prevention measure. And then lastly, really encouraging people to stay home when they're sick, not going into work, not sending kids to school when they're sick. So although there's not specific treatment or vaccine for RSV, there are things we can do to prevent it.
Thank you, Caroline. And I just wanted to add that we're in frequent communication with our hospitals. We're hearing from them as well that they're seeing really high numbers, lots of sick kids with respiratory illness of various kinds. They are managing the load, they have the capacity, but they do also encourage everyone to please take preventive measures, simple preventive measures that can prevent you from getting sick.
There's not too many restrictions on that.
Great. Thank you so much, Dr. Kemble and Caroline. I know that you folks have questions on this. So reporters, please raise your hand, your virtual hand or your real hand, and we'll get your questions answered. Alicia?
Yes.
Hi, good morning. Yes, I'm with Civil Beat. I was just wondering, I know that she said that younger children and older folks in the nursing home are more at risk, but I was just wondering when does a medical provider decide to do the RSV testing?
Caroline, do you want to take that one?
Now, that's the bigger question, right?
Yeah, so for otherwise healthy individuals, say a young person who doesn't have any pre-existing conditions, there's not anything you would change by doing testing. You're still going to do supportive care. For a child, for a very young child, you might have a little more concern and want to watch them more closely if you knew it was RSV. So that might be why you test in a younger child or a very someone a lot older. Do you want to add anything, Dr. Kemble?
Just that also, if a child's going to be admitted to the hospital, it's really helpful to get that test so that you know what you're dealing with. It affects what you're going to do in terms of infection control practices while they're admitted. And it also may reduce the need for antibiotic use and help you to shorten the length of stay.
Is it, sorry, just to add on to that, I guess, what are the symptoms really obviously different from like a flu or COVID symptoms? And is the testing through like saliva or a blood test or just like a breathalyzer?
I can take that. Yeah, so symptoms are pretty similar to a lot of other respiratory viruses, and hence the importance of testing for a child that's more severely ill. But RSV may have a little more of a tendency to cause wheezing. So sometimes there are some subtle differences from other respiratory viruses, but the point is with all of the viruses that are out there right now, it could be any one of them, but preventing them is all similar. It's about staying home when you're sick, washing your hands, staying away from others who are sick. And if you choose to mask, that's also going to reduce your risk.
Great. I see Nina next.
Hi, thank you so much. Yeah, actually, along the same line, since all the symptoms for flu, RSV, and COVID, they all sound very similar. I'm just wondering though, so we do have tests for COVID. Do you think a child that has some of these symptoms, should you test for COVID to rule it out, since we can do that at home?
Yeah, thanks, Nina. And I realized I forgot the second part of this question. In terms of what the test is, it's also going to be a nasal swab test. So very familiar to people now. One nasal swab can test for COVID, flu, and RSV all at once if all three tests are indicated. And I'm sorry, Nina, your other question was
Whether we should do COVID testing.
Yeah, and COVID testing is still a really good idea. We realize that a lot of people are able to test at home now and may be choosing to test at home. So they may already know an initial COVID result. If your child is sick enough to go into the see the doctor, they may repeat the test just to be sure and to test for other illnesses such as flu and RSV.
Okay, and just one more question. You do mention that masks are effective at preventing a lot of these viruses. It just seems that a lot of people have dropped it. But there was a story out of Boston school districts just came out, said it was effective. So I just wanted to see if you wanted to emphasize that a little more, or that mask could play a role if the child is willing to wear it.
Yeah, Caroline.
Yeah, I mean, it's absolutely still effective. It is definitely someone's choice at this point if they're wearing a mask, but yes, it absolutely, because it's going to cover respiratory secretions, coughing or sneezing or anything from somebody who might be sick. So yes, it does, just like for any other respiratory illness, it does help for RSV.
And in some ways, the last 2 years have proven it, right? If we look at what the disease rates were for respiratory syncytial virus, RSV, and flu over the last couple of years, they were nearly non-existent. What was different about those 2 years, it was really the mitigation measures we put in place for COVID-19. So everybody wearing masks and taking a lot of care to stay away from others who might be sick really reduced transmission of those viruses. Now we're getting back to a more normal state of being, but with the return to more socializing and being closer to other people, less mask wearing, we are seeing return of those viruses, including RSV.
Thank you, Dr. Kemble. Cheyenne had her hand up next. Oh, and I see her mic is not working, so she is asking, have there been any deaths locally from RSV?
We have not had RSV deaths reported in Hawaii, I believe. We will double check that, but I don't think we've had any deaths reported this season. We have had hospitalizations and we've had some intensive care admissions. So there are a few kids who do get very sick.
Thank you. And next we'll go to Hawaii News Now.
Good morning, everyone. Thank you very much for doing this. I know you had said that, infections increase on the western region of the mainland. We're also seeing that COVID cases are on the rise in California. So what's the level of concern as we get into the winter months over the, a spike in RSV, COVID, and flu, kind of the, what's been labeled as a tridemic?
These are all viruses that are very familiar to us and to our physicians and health systems. The concern right now with our health systems is seeing them all at once. So whatever we can do to slow down transmission, to take extra care and precautions, to wash our hands, cover our cough, stay home when we're sick, and wear a mask if that is another measure that can reduce your risk of transmitting to others or getting infected. So those are things that can slow down transmission and just make it a little easier on our very hardworking healthcare providers in the community.
And also too, as a quick follow-up and just for background info, I know when looking at the numbers for the last 2 years when mitigation measures were in place, do the numbers that we're seeing with RSV this year, are they more mirrored to 2019 and pre-COVID times?
They are, but as I said earlier, we are seeing an increase earlier in the season as well. Sarah, do you want to add anything?
No, yeah, I think Caroline gave a nice overview of those numbers that it's not that we're seeing disease way out of proportion in prior years, but we are seeing it earlier than we have been accustomed to seeing it. So we don't know if those numbers will continue to climb.
Very good, thank you.
Thanks, and we'll go back to Nina.
Oh, I'm good, thanks.
Okay, great. And then I see that Cheyenne is asking, what does the treatment for RSV look like?
Yeah, so as we said earlier, there's no specific treatment for RSV. It's all supportive care. So at home, that would be things like acetaminophen and ibuprofen for pain and fever. If a child's sick enough to be in the hospital, it would be most likely for respiratory supportive care. So help with their breathing. So either being on oxygen or whatever level of support they might need for breathing as they get over the virus. Anything else, Sarah?
Okay, and if not, we'll go to Chloe from KITV. Okay, and she is asking, does DOH have the exact number of RSV cases this year?
So we do have a number. That said, RSV is not a nationally reportable condition. And so these aren't exact case counts. And additionally, there's also plenty of cases that aren't diagnosed that someone doesn't get tested. But the number of positives that we have seen so far this season is 2,070. But again, it's not exact because there's plenty of people who don't get tested, and it's not a condition where you have to report to CDC every single case.
Okay, and how do these numbers compare to those before the pandemic?
This season's numbers are higher, but we're also seeing a lot more testing. So that's why we talk about the test positivity to try to compare apples to apples. And when we look at the percent of tests being done that are coming back positive, it's similar to prior seasons. I think one area of concern is whether or not we are seeing more severe disease from RSV this year. We're talking a lot with the hospitals about that. They say they're seeing a lot of admissions to the intensive care unit. So there's some concern that illness may be a little more severe this year. It's still early in the season to really see how that will play out, but one of the reasons for concern. Again, this is a really good reminder of why getting your shots for other respiratory diseases are really important for those diseases for which we do have vaccine, like COVID and influenza. That just takes those out of the equation so that you're less likely to end up in the hospital for those reasons, and allows our healthcare system to really focus on those who need the supportive care for RSV.
Thank you. And I see Alicia's hand up.
Thank you, Caitlin. Just one last question. In the event that a child does get sick enough to be hospitalized, are there any long-term effects after they recover?
As with any severe respiratory illness, if you have severe disease, that can lead to longer-term manifestations. So some kids who end up on a ventilator, for instance, may have some scarring of the lungs and they may have longer-term consequences. But I want to remind people that, as Caroline said, the vast majority of children and adults who develop RSV recover fully without long-term consequences.
Thank you.
Thank you. And back to HNN.
Yeah, I know you said that you're seeing the infections earlier in the season. So typically what is generally the timetable of when you would see the kind of curve of infections start to pick up?
Hawaii's peak infections in past years have generally hit around November, December. We don't always follow a typical pattern that we see in the US mainland, and we tend to have some level of RSV activity throughout the year, not just limited to what the mainland considers RSV season. So this year, seeing a peak starting as early as October is a little bit early for us.
And then also one more thing, I know you mentioned that your constant communication with the hospitals, and they said that they're managing everything right now. Is that statewide? Kind of what is happening with the facilities, and kind of where are they in terms of just the response to this?
Yes, statewide, we've been on calls with our chief medical officers and other representatives from hospitals in every county. Everyone's certainly observing this uptick in respiratory illness, and staffing remains challenging throughout the state, but they all have indicated that they are currently handling those caseloads and ready to take care of people who come in the door sick.
Great. Thank you so much. Are there any other questions at this time? Okay, hearing none, really want to thank everyone for joining us today. Like Dr. Kemble and Caroline said, the COVID-19 bivalent booster and the flu shot are readily available. You can see a list of COVID vaccine locations at hawaiicovid19.com/vaccine. And you can get the flu shot and your bivalent booster at the same time, so that's really convenient. I would like to mention one COVID vaccine pop-up that's occurring this Saturday and next Saturday that's hosted by our friends at Queens Medical Center at Palama Settlement in Kalihi. You can find more information about that pop-up at hawaiicovid19.com or on the Queens website. But if there's nothing else, thank you so much everyone for joining us, and hope that you can enjoy your long weekend.
It's a great time to go get your vaccine for COVID or flu, so please go out and get it today.